All right, we are here with Dr. Ingrid Strader and Dr. Jerome Williams, and good morning to you both.
Good morning.
And today we are talking about our pets and their hearts. Is it a sign of aging, or could they be dealing with some kind of heart disease? Good morning.
Good morning. Sometimes it's difficult for us to differentiate whether it's a heart condition or whether it's just the aging process. As I get older, I'm wondering about those things myself.
Aren't we all? Dr. Strader, you said, you know, we were we were talking just now before we came on that, you know, dogs can't tell us, hey, I'm having some pain in my chest, I'm having difficulty doing things.
Right.
So how do you know?
Right, and it's really difficult for me too. So the first line is always, especially when your pet ages, go to your veterinarian, because they will know. They have hopefully already kind of established a history of your pet. They know your pet, and they can do.
This is your sweetheart.
That's right. There's Katie.
And how old is Katie?
She's going to be 15 in April.
Wow. Well, she's beautiful.
Thank you.
And
She's
so,
very
are
sweet.
you notice any problems with her? Or is she?
Absolutely. So, for example, which I hear a lot, there's a lot of what we call inappropriate panting. So they are panting at times they should not. Now, that can be so many things. Is it arthritis pain? Is it maybe some organic disease, endocrine, diabetes, thyroid, so many different things. Or is it actually heart disease? There's blood pressure issues.
Wow.
There can be high blood pressure in the lungs, pulmonary hypertension. It's difficult to know. So again, first off, go see a veterinarian. They can run a lot of tests. And if then they still think that it might be related to the heart, then they can send it to me and we can do some further testing.
So what do you do? I mean, what's available for our pets?
Once we already know it's established that the blood work is normal, then I really look at the heart. And of course, an auscultation is always important. It's nice to really know what's going on in the chest. And then an echocardiogram is just wonderful because you can see great things on there. You can see the inside of the heart, the way it's working. An ECG, somebody say an EKG is important to see if the rhythm is still normal.
Right.
You can do systemic blood pressure.
So
and
just
then,
like we have, the same test we have.
absolutely, absolutely.
All the tests that can be done on people can be done on pets.
Most of them can. It's
And
just
you do most of those in
amazing.
your office.
Yes, we do. We do.
So
right
if you
here.
do find that there's something going on, then what?
So once you know, oh, indeed, you know, yes, there's also some aging, but on top of that, let's just say we have some valve disease. That's actually quite common. Then you see how much has it changed the structure of the heart? Do we need to help or not? And sometimes you don't even yet have to help, but you have to follow up.
Okay.
If they have high blood pressure, they have almost the same medications as we do.
Really?
That's really interesting.
So our pets deal with high blood pressure, and that may be something that can, I would imagine that can go a long time without being diagnosed.
Very long time. It sounds easy, especially for us. It's such a common thing to do. It's not quite as easy and straightforward to take in a pet, actually. And the other thing we recognize more and more is that they also can have high blood pressure in the lungs, pulmonary hypertension, and that only the echocardiogram with a Doppler can really look at
So
that.
how often, Dr. Jerome Williams, then do you, when you're following up with your regular checkup, do you notice things right away?
Yes, we'll, in addition to the history that we'll be given that my pet's not doing right, and we use the term ain't doing right, you know, ADR. And then we'll try to get to the bottom of it, you know, what behavior differences are we seeing? Is he refusing to go up and down the stairs? Is he panting a lot more, you know, when he does a minimum amount of exercise?
I would imagine the stairs would be a sign because they're trying to tell you, I can't do this.
Yes,
Yeah.
yes, yes. And as she mentioned, and I'm seeing it now with Jill more, the inappropriate panting. So it indicates something is going on that is not normal.
All right, well, just a heads up, kind of keeping an eye on it, and really the importance of having a regular checkup. Thank you both.
Absolutely.
Thank you both for being here.